before turning over the presentation to Director Rochelle Pride.
Every resident, every day.
Here at the Office of Justice Policy and Programs.
These aren't just words on paper. This is how we do business every day.
So the impact that Pathway have in my life is they help me with coping skills. They are a good support system, and they help make my life choices better. And another thing, I started volunteering down at JPP. Eventually, I was hired on as a reception and donate specialist. And now I'm working at the Rapid Resource Center as a reentry navigator.
Hello. To our Franklin County Board of Commissioners and County Administration, we appreciate your support to the Office of Justice Policy and Programs and CASA of Franklin County. Our dedication to the 1.3 million residents of Franklin County is unwavering, steadfast, and fireproof. And because of your support, we can continue to serve every resident every day. Thank you.
Thank you. I will now share my screen and begin our presentation. Good afternoon, Commissioners, County Administration, and community members, as well as Team Franklin County. My name is Rochelle Pride, and I serve as Director for the Office of Justice Policy and Programs and CASA of Franklin County. Today, I am pleased to have with me Melissa Pearson, OJPP Chief Operating Officer, and Kevin Greenwood, Deputy Director of Survivor Services and CASA. On behalf of our offices, it is my honor and privilege to present our fiscal year 2023 budget request, an overview of this past year's highlights, along with challenges and future objectives. While 2022 is propelling us post-COVID, the full impact of the pandemic is still unknown. Yet the Office of Justice Policy and Programs has persevered in serving every resident every day. In 2019, our Board of Commissioners released the Rise Together Poverty Blueprint and Innovation Center to address poverty in our community. The blueprint lists several large goals and small steps to achieve these goals aimed at addressing poverty, including but not limited to employment, housing, health, and youth, to which the Office of Justice Policy and Programs and CASA has continued to advance through various efforts and initiatives grounded in our mission. In 2021-2022, OJPP's current funding strategies and portfolio are geared to better align with the longer-term policy goals of the newly established One Door Project and Franklin County Health and Human Services ecosystem. JPP strategically planned budgetary and personnel expansion to support these practices and initiatives. Expansion goals have been realized and pending further implementation. OJPP proposed budget for calendar year 2023 reflects 6% growth from last year in terms of anticipated revenues and expenditures. However, a 31% increase when compared to calendar year 2021 and 193% when compared to OJPP's budget in calendar year 2019. Growth reflects additional federal grant funding received to support reentry, overdose prevention, and transitional housing, and inclusion of county subsidy funding to sustain several key successful programs like male and female pathways programs, the Rapid Resource Center, and its expansion to the new jail, and respite housing for homeless individuals released during third shift from the jail. Since printing the final budget brief, our office has received an additional federal award in the amount of $1.6 million through the Comprehensive Opioid Stimulant and Substance Abuse Grant from the Bureau of Justice Assistance. Therefore, 2023 projected revenues are actually higher than you see before you. Despite annual growth, subsidy provided by the county has remained fairly static, ranging between 19% and 26%. OJPP's outreach and engagement has increased exponentially over the last 5 years. As demonstrated by this slide, The biggest jump in FTEs occurred between 2020 and 2021 when Franklin County absorbed CASA program. The 2023 budget reflects the addition of 7 FTEs to support expansion from 1 to 2 rapid resource centers operating 24/7 and additional fiscal functions resulting from OJPP's growth. It can't be argued employees are the true assets of an organization. OJPP has been fortunate to receive additional funding from county administration and the BOC to support onboarding of additional staff needed to meet the expanded vision and mission of our agency. Since the merger of CASA and OJPP in 2020, we have increased our staffing levels by 8 FTEs or 32%. In addition to our full-time staff, OJPP now has 20 contract staff on the team. These key members of our team are critical to the mission of serving every resident every day, one person at a time. As previously mentioned, OJPP manages several discretionary and formula grants. OJPP has managed to increase revenue from local, state, and federal grants by 173% between 2019 and 2022 to support Board of Commissioner priority initiatives. Increased grant revenue prioritizes emerging trends with the goal of solidifying proof of concept. Once this goal is met, general fund revenue must be considered to sustain conceptualized practice, continuity of service to Franklin County residents, and job security. Currently, grants account for approximately 67% of JPP revenue, which support internal and external programs, job classifications, fringes, and other agency operations. In 2022, as I mentioned, with support from our Board of Commissioners and County Administration, JPP received a general fund subsidy of approximately $1.8 million to support key initiatives, programming sustainability, and capacity building for 2022 and 2023. You've heard my colleagues talk about our human services value curve and social determinants of health. Now, with this visual in front of you, I will expound. The human services value curve and social determinants of health serve as a compass and measurement of our work. The curve is a transformation framework and system-wide theory of change that inspires and equips leaders and policymakers of health and human services organizations, systems, and communities to create a path for achieving better and more equitable outcomes for individuals, families, and communities, as well as improve and accelerate human services and social and economic value of society. The regulative portion of the human services value curve is transactional and maintains status quo adherence to system policy, procedure, rules, and regulations. The second phase is collaborative. It drives collective impact to ensure a robust and multifaceted approach to system service delivery. The next phase is integrative, which focuses on thriving by ensuring social and economic mobility are priority and addressing the root causes of system challenges and opportunities in those we serve. And the last phase is transformation. Community health recognizes these characteristics among several social determinants of health, which affect a wide range of health risk and outcomes. Social determinants of health constitute the conditions and the places where people live, learn, work, and play, and include social and community context, education, healthcare, neighborhood and built environment, and economic stability. The models support target universalism, which ensures itemized approaches to broader barriers. As we continue to streamline our work to align with several goals and objectives of the Rise Together Blueprint, our youth and the impact of COVID on their mental, emotional, and educational well-being is critical. With COVID having caused significant disruption to the global education system, researchers are concerned with the impact this has had on student learning loss. Teachers in 8 countries were asked to rate the effectiveness of remote learning when it was first rolled out in response to school shutdowns between March and July of 2020. They gave it an average score of 5 out of 10. The grades were especially harsh from teachers in Japan and the United States, where nearly 60% rated the effectiveness of remote learning at between 1 and 3 out of 10. That barely beats skipping school altogether. Remote learning not only decreased educational attainment, but increased the likelihood of child abuse and neglect. These studies continue to highlight the unmatched impact and necessity of our CASA program. As CASA continues their work in advocacy for abused and neglected children, there is a sizable body of research investigating the link between child maltreatment and adverse educational outcomes. Children who have experienced abuse or neglect are at an increased risk of lower levels of cognitive functioning, language development, achievement in reading and math grades, school attendance, suspensions, and decreased personal expectations of attending college. Maltreated children are also less likely to finish high school and gain university qualifications, which in turn leads to unemployment and lower incomes, which promotes surviving versus thriving. In the past 10 months, 256 active CASA volunteers have served 644 children, representing 323 family units. In 2022, CASA Franklin County provided 33 continuing education courses for existing volunteers for a total of 61.5 hours of specialized training. So far this year, CASA volunteers have donated over 10,000 hours of service to abused and neglected children in our community. In September 2022, CASA Franklin County set a new state record for volunteers at the Ohio CASA Conference, with over 10% of participants in the 3 days of training coming from our community. The registration fees for all 48 volunteers were paid by scholarships from the Supreme Court of Ohio or the nonprofit Friends of CASA of Franklin County. This year, partnerships are under development with Nationwide Children's Hospitals on our sleeves, the movement of children's mental health, and ensuring proper awareness, education, and timely support remains at the forefront for our youth. On our sleeves has also yielded collaboration opportunities with our Credible Minds platform. CASA is also working with the nonprofit organization VESA to engage diverse community members to volunteer for positive change. Lastly, in a self-assessment of programs conducted by the National CASA GAL Association, CASA Franklin County met 221 measured elements of practice out of the total 226. This equates to a 97% compliance of all measures. Next, I would like to highlight our efforts in meeting residents where they are while supporting them in navigating their next step. Our reimagined mission for the Rapid Resource Center is to increase resource access for residents impacted by the justice system through transition planning, treatment referral and linkage, harm reduction, education, and other identified services which support positive community reintegration and reduce the likelihood of recidivism. The RRC launched in February 2021 at our Jackson Pike facility. The Rapid Resource Center was developed to provide immediate access by individuals just released from custody to supportive services. The program is overseen by our licensed clinician, Mr. Ryan Newsom, and relies heavily on the support of OJPP team members, peers, and community health workers to engage with clients. The multi-agency collaborative effort has included Primary One, Columbus Public Health, Franklin County Public Health, and the Family Stabilization Unit. To date, more than 3,000 individuals released from incarceration and or their family members have received services through the Rapid Resource Center. 1,884 have received intense support and hard linkage to services. In October 2022, the RRC went to 24/7 to support residents released after normal business hours. In partnership with TKCK Investments, the Rapid Resource Center will recently launched the Bridge program, which will provide 3 to 5 day respite housing and stabilization for residents indicating homelessness at booking into the jail. Earlier this year, our Franklin County Board of Commissioners approved another Rapid Resource Center location, which will operate out of our new James A. Carnes Correctional Facility. The new Rapid Resource Center will provide greater accessibility to service, increased capacity, and heightened collaboration. In partnership with CODA and support from our county administration and government affairs, the Rapid Resource Center launched an on-demand transportation for residents being released from Jackson Pike, in addition to family and employees. This on-demand service will also be available to residents released from the James A. Carnes Correctional Center. In continuing our partnership with the Family Stabilization Unit, the Rapid Resource Center is also working to launch a workforce development hub to ensure real-time access to employment, credentialing, and training programs using a human-centric, warm handoff approach with established partners. Next, you will hear about more Hallmark programming that we have provided to our residents from our Chief Operating Officer, Ms. Melissa Pearson. Take it away.
Good afternoon, Commissioners and County Administration. Again, Melissa Pearson, Chief Operating Officer for your Office of Justice Policy and Programs. Commissioners, it's well known individuals leaving a carceral setting are at a significant heightened risk of overdose and death upon their release. In fact, in calendar years 2017, 2019, and 2020, we know close to 20% of the individuals that died of an overdose in those respective years were in our jail the 12 months preceding their death. We believe this represents an incredible opportunity and obligation to engage and mitigate some of this risk. To this end, in 2019, the Franklin County Office of Justice Policy and Programs embedded a medication-assisted treatment coordinator, Elizabeth, in the Franklin County Correctional Center. In collaboration with the jail medical services provider, the MAT coordinator assists with the coordination of MAT services for residents pre-release. In addition to meeting with individuals who are screened at booking at high risk for an opioid use disorder to discuss MAT options and begin the process for initiating services pre-release, the MAT coordinator facilitates harm reduction education in the jail and coordinates the distribution of naloxone kits to all high-risk individuals at release. To support continuity of care post-release, OJPP was able to hire a MAT discharge planner in 2021 to develop recovery plans and ensure treatment linkages were established in the community. To date this year, 138 individuals have received medication-assisted treatment prior to their release from the jail, which reflects a 94% increase over the number served for the entirety of 2021, which was largely due to the pandemic. Lastly, we are proud to relay an agreement with Base Camp Recovery was established this year to support weekly facilitation of pre-release MAT groups in the jail. For 2023, we are eager to continue our partnership with the Franklin County Sheriff's Office by expanding the availability of medication-assisted treatment induction options to include other long-acting injectables. Next slide, please. Commissioners, in 2015, the Franklin County Office of Justice Policy and Programs launched the Pathways Achieving Recovery by Choice program for justice-involved residents identified at booking into the jail as at high risk for mental health and/or substance use disorders. In 2020, in collaboration with Alvis, we were able to launch the male version of the Pathways program. The goals of both programs are to expand access to pre-release medication-assisted treatment, improve the continuity of behavioral health treatment immediately following release, decrease illicit opioid misuse, and strengthen pre- and post-release supportive services to mitigate challenges and barriers for re-entry and recovery. The program includes screening and assessment, 8 weeks of cognitive behavioral treatment, linkage to MAT, transition and recovery management planning, and peer support services. We are proud to relay that the Female Pathways program was once again nationally recognized and highlighted by the National Sheriff's Association, the COPS Office, and the National Policing Institute in their 2022 Jails Compendium Toolkit of Best Practices. Next slide. And this is an overview of our Male Pathways program. It gives you a slight, kind of a snapshot of the numbers we've been able to serve. You'll see the numbers for the Male Pathways program was a little bit smaller. They had a later start, but we were also largely impacted by the pandemic in 2021 and even going into 2022. So you'll see those numbers are a little less, but we're eager to get ramped back up in early 2023. Next slide. Commissioners, Safer Stations, through vast partnerships, including representation on a statewide quick response team, OJPP launched Safer Stations on the west side of Columbus, September 6th of this year, and has already received 120 walk-in visits from individuals seeking treatment services, distributed 273 Narcan kits and 312 fentanyl test strips, and transported 6 individuals directly to treatment. Safer Stations serves as a walk-in center and first responder deflection program offering brief medical screening and direct same-day linkage to substance use treatment for individuals actively using drugs and at risk for overdose. The Safer multidisciplinary team works to redirect individuals using drugs away from our jails, away from our emergency room departments, and toward community-based treatments. The model is grounded in addiction science and emphasizes a non-judgmental approach and to service provision. The multidisciplinary Safer team is active in the local community and is already hosting Outreach Fridays on their doorstep. In 2023, harm reduction efforts will be expanded as Safer will serve as one of 7 sites including the Rapid Resource Center at Jackson Pike, partnering with both our public health departments to have a 24/7 accessible prevention vending machine available to the community, offering free access to naloxone, fentanyl test strips, condoms, and pregnancy tests. Stay tuned because we have lots more exciting updates to come about the Safer Stations in 2023. And with that, thank you for allowing me to present these slides, and I will turn it back over to Director Pride.
Thank you, Melissa. Next, I will talk with you about our Youth of Incarcerated Parents Initiative, which was recognized this year by the National Association of Counties for the 2022 NACO Achievement Award. Several studies have found that parental incarceration is a risk factor for children's academic and school-based outcomes and strongly impacts their self-efficacy and overall success. For example, in one study, researchers found that elementary school children where incarcerated fathers were more likely to experience grade retention than their peers who had not experienced parental incarceration. And their sample of children currently affected by their mother's incarceration, the same study found that 49% of children aged 9 to 14 experienced behavioral problems at school, which led to their suspension, and 45% expressed little to no interest in school. When an individual is incarcerated, it has consequences for one's entire family. As mass incarceration has increased in the United States, more and more children experience a parent incarcerated during some part of their childhood. A 2017 report by the National Institute of Justice estimated between 1.7 and 2.7 million children have experienced a parent being incarcerated, or 11% of all children. In 2016, estimates for Ohio children found that 271,000, or 10% of children, experienced paternal incarceration at some point during their childhood. This number has continued to increase. Several outcomes have been linked to children impacted by parental incarceration, and in collaboration with our Family Stabilization Unit, Nationwide Children's Hospital, Franklin County Common Pleas Court, and several community stakeholders, Franklin County worked to bridge the gap between parental incarceration and the families left behind with this new initiative. This focus makes sure that services are coordinated for families and youth who are left behind when a resident is placed into a carceral setting at sentencing, and ensuring that jail and prison or prison in reach and pre and post release support is provided. As you can see, based on the slide, a couple data points that we want to highlight is the average age of youth served through this pilot, which began in July of 2022, was 7 years old. We also saw that 64% accounted for single mothers and 35% accounted for grandparents. What we also identified with the case dispositions at sentencing is that probation violations and probation revocation hearings were the highest cause for the resident returning to court to be sentenced. As we've heard of the school to prison pipeline, we now must be aware of the probation to prison pipeline. Our I Father a Child program under our Children of Incarcerated Parents grant program is a project designed to provide short-term intervention by provision of services for fathers, their children, and the mothers and/or caretakers to connect to local resources. The project aims to recruit and enroll 150 eligible fathers and their families from 3 of our local host sites, Alvis House, Jackson Pike, and soon our community-based correctional facility, over an 18-month period. Fathers participate in fatherhood discussions, have access to information related to child custody and support, and connect with training and immediate employment opportunities, along with a myriad of services related to health and well-being offered to mothers and/or caretakers from our partners, such as Nationwide Children's Hospital, connections to supportive resources, learning and care exploration, and other assistances are realized. Children also receive trauma-informed care, mentor matching, self-efficacy, and reading assistance. In 2023, we will also be focusing on women who are incarcerated with children and understanding what their access is to prenatal care and support resources pre, during, and after the birth of a child. According to Washington, D.C. Justice Lab, 1 in 5 people incarcerated worldwide is locked up in the United States. 1 in 3 adults in the United States has a criminal record. 1 in 2 has a family member who has been incarcerated. Mass incarceration and other pervasive systematic barriers continue to prevent successful reintegration of justice-involved residents returning to Franklin County from local or state incarceration. The barriers include lack of affordable and accessible housing, substance abuse and mental health, and underemployment or unemployment. Failing to adequately address the reentry needs of residents will lead to jeopardized public safety outcomes, higher unemployment and poverty rates, increased addiction and overdoses, homelessness and mental health decompensation, as well as intergenerational cycles of criminal justice involvement with our disproportionately affecting African American communities. The Franklin County Criminal Justice Planning Board and the Franklin County Reentry Advisory Board are actively adopting action steps that minimize these barriers to successful reintegration efforts and reduce the overrepresentation of individuals of color and those with serious mental illness in our jails. The challenges that you see before you have been owned, and we are accepting the call to action to address these in our next 2023 strategic plan. The list of objectives you see before you are being actively deployed and planned in collaboration with a host of community partners to ensure public safety, systematic change, and greater capacity to sustain and build better service to our residents. Our 5 to Thrive is what we have titled our Diversity, Equity, and Inclusion Goals for 2023 and beyond. Diversity, equity, and inclusion are not 3 different ways of saying the same thing. They are 3 different things to ensure the space we occupy is diverse in people, experience, and thought, equitable in decision-making, process, and procedure, and inclusive in creating belonging and intentional interactions both personally and professionally. The DEI goals you see before you are OJPP's planned action steps toward ensuring that we began the process of infusing what our County Administrator Kenneth Wilson refers to as embedding DE&I in our DNA. On behalf of Team OJPP and CASA, we sincerely thank our Board of Commissioners, County Administration, OMB, our fellow Board of Commissioner agencies, and a host of community partners for your support in helping us execute service and stewardship to every resident every day. To our dynamic team of OJPP and CASA staff, you are the best team on this side of the equator. Thank you all for what you do. There is no me without you. Thank you. And we will take any questions at this time.
Commissioners or County Commission, any questions or comments?
Yeah, I would like to know, and I think that good overview. Thank you so much for that, especially starting out with the dollars and cents, and then incorporating all the work that you all have been done. I think that was a really great presentation. And thank you all for all the work that you do in the reentry space, and then making sure that we keep our recidivism numbers down and just meeting people where they are. So one of the questions that I have, which I just wish I could get this information probably more on a quarterly basis, especially since I got a series going on what does a county commissioner do and what do my colleagues and I do. I think it's important to have the numbers on. You had it on there, it was very small, like pre the Pathways program and then post, and I really couldn't see the numbers, but I think that's we need to be highlighting that, right? We are investing in people, that is what we do. And that it's these are the outcomes, that people are not recidivating, right? That they're getting connected with resources, and if we're tracking measurements, how many times may they have come into the criminal justice system or come through our jails? And then when was their first interaction with the Rapid Resource Center? And then, do we keep track on what the stability looks like afterwards? I think that's important. One of the things that I didn't see on your graph when it came to the Rapid Resource Center and connecting people with services is housing. I mean, you mentioned a partnership to do respite care, but with the grant money that you have in the increased budget, I guess next year, what do the numbers look like on the people who have come through the Rapid Resource Center who needed permanent supportive housing or needed somewhere to go?
So on this, on the slide, and we can definitely share this too with your office, Commissioner, so that way you can have this in real time and up close in person. We do.
Well, all of the commissioners, not to cut you off, because I
Yes,
know.
yes,
The
everyone.
Commissioner Boyce asked all the time, like, how are we reaching in? And I know he would, I don't want to speak for him, his staff is on here, but I know he would, love those numbers too, and I know he gets updates too.
Yes, yes. And we will provide that. Currently, what we have on this list in front of us, we don't have specific to housing resources that are asked for. But I will pass it to Melissa because there may be data that I am not seeing in front of me, Melissa, that we do have as it relates to specific housing, transportation, and other social determinants of health that have been realized. I will also say before she answers that question, we are working in tandem with our Health and Human Services team to make sure that the emergency housing focus is intentional for all intercepts. So that way from the Rapid Resource Center, whom we may see, who may stop down to our office, to any other agency who may, of course, encounter the need for housing through a resident, that those are being realized as well in that next project for One Door. But Melissa, I will let you go forward with that.
Sure, and just to in all transparency, we all know housing is one of our biggest challenges. But with the support of the commissioners, I think next year you're going to see a rapid expansion of our capabilities. What we have available now is our frequent user systems engagement program, which is called FUSE. And we really have focused in on those individuals that are cycling in and out of our jail, in and out of our emergency rooms, in and out of our shelters. So we have about 35 individuals placed in permanent supportive housing. And we work with the Corporation for Supportive Housing and Integrated Counseling to provide that particular program. We also have a Justice Rapid Rehousing program, which supports the Common Pleas Court. When they have an individual who is leaving the jail and or the prison system and they know they are housing insecure, and that could very well lead to further escalation into the criminal justice system, they can place them in a shorter term, it's 3 to 5 months, in a shorter term housing program. And again, we also coordinate that with Corporation for Supportive Housing. I will tell you also that we are in contract with Alvis. We currently have 8 to 12 beds available to our team. So when an individual visits the Rapid Resource Center or comes into our office, we can refer them same day. And oftentimes within 24 hours, they will have a bed at Oasis, which is the Alvis housing program. And then the other program that we are working on is with the Community Shelter Board. We all know that right now with the shelter on overflow status, that means everybody has a bed available. So it's educating our team to make sure they know nobody will be turned away. But also we want to make sure that come March, April, there's still access so that when we call in the middle of the night, there's a bed available. So we are in I don't want to say contracts yet, but we are in discussions with the Community Shelter Board in Southeast to see if we can't expand our access to dedicated beds to individuals coming out of the jail system. And then lastly, as Director Pride mentioned, we have a contract with TKCK for immediate short-term respite housing. And then we'll attach a peer supporter to that program so that they can be working on what are the next steps? Where will you go after you leave here? For some of them, that may mean the shelter system, but we just want to make sure everybody has a roof over their heads. And so we will be working on this really, really strategically throughout this year, and we'll make sure that the commissioners are kept apprised.
Thank you for that. And I see that you have a request or a recommended budget for expansion for the reentry program. So several new staffing positions and some other additional program supports that are needed. So I'm assuming that's going to get you to where you all need to be to do all this work. And so not to put more on your plate, but one of the questions that I have is dealing with reentry and CBCF, our community-based center and partnerships there.
Yes, so with our community-based correctional facility, we've actually been in several conversations with the team there to, one, figure out how we can best support them from a clinical perspective, making sure that residents that are housed there have the access to an actual doctor for just basic medical needs, all the way to just mental health and any other additional services that are identified. Because what we know is that you can have a great and robust program structure, but if basic clinical supports are not in place, their chance of success through that program is very slim. And so we are working with them in concert with Adam H to help secure dollars to support the various clinical services and programming efforts. We also just worked with them to actually submit a grant with a neighboring, well, not necessarily neighboring directly county, but Cuyahoga County in their correctional-based facility, which is Oriana House, to make sure that there is some fusion between accessibility to support services and embedding other best practices into the work that they're doing to sustain what they need as it relates to those clinical and programmatic services. So we have been, again, very much infused with CBCF and making sure that they are not on an island by themselves, but they are very much included in everything that we're doing for our residents impacted by the justice system.
And I know that they have a partnership, I guess, once, and the ribbon cutting is coming up with Alvis. I will not be here, we will be at Luck. But I know that there's a partnership, or supposed to be, between CBCF and Primary One Health, which will be on the other side of the new Alvis facility. But they've been there, CBCF has been there, and they have, when I met with them, I don't know, last year or earlier this year, they had a concern about services for their residents, medical, mental health, and then, you know, having some concern about, once they were released, recidivating because they just didn't have the support services. I see Director Bivens. Go ahead.
Yes, Commissioner, and as you know, I do sit on that board as an appointee of the judges. However, in my capacity as that you all have appointed me to, at the last meeting, we are working with our HHS team to identify a person from the HHS team that would intercept those individuals up on before release, so they can get those those core services before they're released back to the community. So initially I had a meeting with Director Lindenboom, because one of the primary concerns was the Medicaid, ensuring that their Medicaid was intact. So as we had a continuing conversation, we are now looking at putting a worker out there so that they can have a core services worker in their building.
Thank you. And what about youth of incarcerated parents? Are they included in that program, or?
Yes,
Yeah.
so CBCF, they were initially a part of the cohort for that in-reach to the fathers and then back to the caregivers and youth. Due to COVID and some staffing issues at the facility, they were not able to take a part when it initially jumped off, but they have recently circled back and they are now ready to begin that infusion of children of incarcerated parents for the residents that are there as well. I also will mention too, kind of going back to the prior question, I'm also in quarterly meetings with Adam H to talk about that continuity of care with CBCF, where they are physically located, with Maryhaven and Alvis, making sure that there is a wraparound component for those residents, because what we unearthed, and as we all know, we are all serving the same people. And so with them being so close in proximity, the goal, in addition to what has been discussed, is to make sure that there's a wraparound from those facilities directly and intrinsically through the programming.
Thank you. And then just a last question, the 42% of the budget, that's grants. Those are grants that continue all the way through 2023, or does any of them end? I'm sure they all end at varying times, but.
I will, Melissa, go ahead.
Sure. So there are a couple that will end September 30th of 2023.
Okay. All right. That's it. Thank you all. I appreciate it.
Thank you, Commissioner.
And if there are no other questions, I'd like to thank Director Pride and her team at Justice Policy and Programs for today's presentation. And Commissioner, if you're ready, we can go to our next hearing, which will be from the Franklin County Office on Aging.